I think that some of the barriers include resources for patients to receive recommended treatments because many times these types of therapies that are being recommended through the guidelines do require frequent visits to the community oncologist's office, the ability to kind of follow through on detailed treatment plans, supportive care recommendations that need to be followed for the purposes of fending off infection and managing transfusions. So having enough support in the community can be a challenge, especially for patients that live in rural or underserved areas where there may be distance barriers to these types of care programs. I also feel that other barriers include some of the intensity of therapeutic modalities that go into even lower intensity therapies. So again, these are treatments that result in even low intensity therapies that result in a high degree of severe cytopenias and risk of infection. And you really need to stay on top of these patients to manage them appropriately. There's a frequent need for dose reduction or treatment interruption. And, sometimes less experienced community oncologists may have difficulty in managing these diseases that they may not see quite as often. So I think the barriers reflect both are resource-based, but also perhaps experience-based with these rare diseases. And it's really critical to maintain close connection with an academic center to help provide guidance for the care of these patients, and really to understand when treatment needs to be changed, when treatment may need to be interrupted, when a change in therapy may be necessary altogether, in order to achieve the best outcomes for these patients. So it's really a partnership that we need to emphasize between the community oncologists and the academic oncologists to ensure the best outcomes for these patients that are being treated in the community.